Hi guys, this is Dr. Denny Warren. In this video, I'm going to give you a full review of the research that was collected by Dr. James Chestnut. It's all in this book right here. And the name of this book is The 14 Foundational Premises for the Scientific and Philosophical Validation of the Chiropractic Wellness Paradigm. So this is a postgraduate certification that I went through. And really what the whole certification was about is digging in hardcore into all the research of why chiropractic, if practiced properly, fits perfectly into a whole wellness model. That's also important for your nutrition. It's also important to work on your diet, your exercise. Important to work with your mind and having positive, loving, healthy thoughts. But this research shows how chiropractic fits perfectly with that entire lifestyle. Now it's going to be a little bit more meatier. It's a meaty topic. There's going to be some neurology, some physiology, but I know that there's some people out there, some of you will want to see this, some of you will actually appreciate this, because I'm one of those people myself. I actually needed more of a definition, more of an understanding. I need to know more of what the research was actually showing about this topic, because I wanted to feel that what I was doing was in fact the best thing that I could be doing for my patient, because they're going to be paying their hard-earned money to come in and to receive the care that we give them in our office. And so with this research, I am so proud of what we do in our office. I love it. And you're going to see why I feel that every single person, especially people that are living the industrialized life, sitting for hours with poor posture in front of their desk, not getting enough movement, not getting enough exercise, eating bad food, are stressed out emotionally and mentally. All those people, most of the people living in the industrialized world need to have chiropractic care on a regular basis. And they need to continue to have it for the rest of their life to help them be their best, to help them function at their best. Now, of course, you don't have to have it. You also don't have to have a dentist. You also don't have to eat healthy. You don't have to do all these other things, but it's a choice and it's something that can give you a better quality of life if you incorporate it into that. And so I'm going to start with this. I'm going to start with giving you some understanding of the proper neurology and why proper motion of the spine is absolutely essential. So I'm going to talk about movement of the spine. And as chiropractors, movement neurology is one of the most essential nutrients ever identified for brain function and brain health. And so I'm going to dig into that. So there's a word called proprioception. Proprioception. So some people have heard of this. If you've had any studies in health science, you've probably heard of this. There is nerves that go from your brain down your spinal cord. From your spinal cord, there's nerves that exit and go out to every single part of your body. You can see this poster right here. This is the side view of the spine. Here's the brain up here. You got your spinal cord. You have all these nerves that come out to all the different organs. Every organ is connected back to the brain. There's nerves even go out to your fingertips. There's nerves going out to your feet. There's nerves throughout your entire body. And your brain, your nervous system is controlling and coordinating the function of every single thing in your body. Now that's very, very important to understand. So one of the most important things for brain health is that stimulation that you get from your body up to your brain. Excuse me. And the term for that, the term I'm going to talk to you about, is called proprioception. Proprioception. So when you see the word proprioception, I want you to think of proprio, think of that as a positive stimulation. So it's a positive stimulation from your body. So this is the head here. This represents the spine. So the body's down here. So it's a positive stimulation from your body that goes up to your brain. Now every time you move your body, what you're doing is you're stimulating the nerves that are in those muscles. You're stimulating the nerves that are in those joints. You're stimulating the nerves that are around the disc in your spine. You're stimulating the nerves throughout your entire body. If you're moving your fingers, you're stimulating the nerves in all the muscles and joints and all the soft tissue in your body there. And what that does is that sends a proprioceptive stimulation from that nerve all the way up the nerve to the spinal cord, up the spinal cord to your brain. And that charges your brain up. That helps your brain function properly. Okay? Your brain needs that. So what happens is Your brain receives that proprioceptive stimulation and it interprets all that information that just got sent to the brain. Then your brain knows, hey, if you're moving your fingers over here, it knows where your hand is in space. You know, you could take your hands and you could reach behind your hand and you could grab your finger without ever looking at it, without ever touching it, without ever smelling it. You know that your finger is right there because your brain is getting information, proprioceptive information, every single second about where your body is in space. And that, again, that proprioception is essential to charge your brain so your brain can function and control and coordinate the rest of the body appropriately. So let me help identify several different pathways that have been clearly identified in neuroscience. There's pathways called movement pleasure pathways, movement stress reduction pathways, movement affect or emotion pathways, and movement cognition and learning pathways. So let's talk about those for a second. Every time you move your body, again, if you move your spine, if you move your legs, you move your fingers, that proprioceptive stimulation goes up the nerve, up the spinal cord, to your brain, helps your brain function, it charges your brain up. In your brain controls cognition, your thinking. It's all up here in your brain. Your affect or your emotion, how you feel, if you're happy, if you're sad, that's all controlled up here in your brain. Your stress and anxiety centers, there's an area in your brain called the amygdala, which is your stress and anxiety center. So if you're just really stressed out, the amygdala is firing off like crazy in your brain. Proprioception stimulates and actually calms that area down so you're not as stressed. And then there's movement memory pathways which go to the area of your brain called the hippocampus. When you hear hippocampus, the second part of that is campus. When you think of a campus, like the university or a campus, that's an area for learning and memory, right? So when you think of your brain, the hippocampus is an area for learning and memory. When you have movement neurology, that proprioception, that stimulates your hippocampus and it actually causes the growth of new cells in your hippocampus. That's one of the only things that's ever been identified that causes neurogenesis or growth of new neurons in your hippocampus. So how can you apply that? Think about that for a second. You need to be a lifelong exerciser, lifelong walker, yoga, whatever it is you enjoy, so that way your chances of Alzheimer's and dementia go way down because that proprioception is driving your brain to grow those cells. So, proprioception is essential for all those things. It's easy. I'm going to give you an everyday example for this. Think about a day or a time when you're sitting inside on your couch. You're not going to do anything that day. You're just going to be lazy all day long. You're eating more food. So you're putting food, which is energy, you're putting that energy into your body, sitting there on the couch watching TV all day long. Think about how you feel at the end of the day. Do you have more energy? Is your mind alert and active and feeling really good? Or do you feel really lethargic? Do you feel like you have very low energy? Do you feel like your mind, you can't focus on things? It's the second, it's the latter, right? And the reason for that is you're not getting that proprioceptive, that movement stimulation that your brain absolutely has to have to function to be healthy. Now compare that day to a day where you go out for a walk. You might be stressed out before you go on that walk. You might still have the same stressors when you get back from that walk. But here's the thing, when you go out and you move your body, your entire body, your legs, your limbs, your spine, your torso, all of these parts of your body, you're stimulating those nerves and you're stimulating those movement pleasure pathways, movement cognition, movement emotion, movement learning and memory. So when you get back from that walk, how many of you ever felt where you can think clear, that you feel like you're more relaxed, like you're not as stressed out as you once were? You feel like you're happier after you go for a walk and you feel like you can think and focus better. Those are all things from movement. And here's one thing I want you to know. These proprioceptive nerves are loaded. The main area where the highest density of proprioceptive nerves in all your muscle fibers and your ligaments is right here by your neck, the very top part of your neck. It is essential that you get good motion from this part of your neck to stimulate your brain to function properly. There's also areas in your brain, I didn't mention this, but there's areas in your brain that control your viscera are all of your organs in your entire body. So all of your organs, there's areas in your brain that control it. And this proprioception stimulates those areas so you get better control of all of your organs. Now, so I get back to this. The highest density of proprioceptive nerve fibers is in the upper part of the neck. After that, you then look at the rest of the spine, right along the spine. The spine is loaded with tons of nerves in all the muscles, tons of nerves in the joints and the ligaments and the disc, but they're all loaded on that soft tissue right around the spine. And the main reason for that, it needs all those nerves because there's so many different types of movements. You can rotate, you can flex forward, and you can extend backwards, you can laterally flex. You have such fine motor movement in your spine, it has to have a lot of control in that area, so there's a lot more nerves in that area. So there's a ton of stimulation right along your spine that sends a barrage of information and stimulation to your brain to help your brain control and coordinate everything better. Now after your spine, you look at your fingertips. Your fingers and your hands require a lot of nerve fibers in them because there's very fine motor movements. You might be playing Mozart. You might be dribbling a basketball. You might be throwing a pitch. You might be doing all these different things where you need a lot of control over your hands. You might be writing, typing. All these different things require fine motor movements. In your hands, you have a lot of proprioceptive nerve endings, also in your feet. So again, upper part of your neck is the most stimulation to your brain because of the density. There's this slam packed with all those nerves in that area. The spine is next, the hands are next, the feet are next, and then the body, the rest of the body kind of follows after that. So that stimulation is essential for the whole function of your entire body. Now, I want to give you an example with different phases of our life why this is so important. When you think of children when they're born, children are born with soft spots on their skull. These soft spots are very important for them to be there because their two hemispheres, their cerebral cortex on the top of the brain, they haven't developed yet. Because you don't see a child, a newborn child or an infant, solving calculus problems or communicating and problem solving with you and figuring out the solutions to all the problems on the earth. You don't see that happen. They're just learning, they're just soaking up all this information from the environment. They're learning how to survive in that environment. But here's something that's very interesting. This proprioception goes up and it stimulates the growth of the brain. When a child, and a lot of you might have heard this, there's different phases of development that are very important for children. At first, you want them to be able to bobble their head around, move around, and be able to observe the environment. That movement from the upper part of the neck, that's the most highly dense, highly populated nerve fibers in that area. That movement, when they're bobbling their head around, is sending a ton of information to the brain to grow their brain. That's very important. And then they start to move the rest of their body. They're not coordinated yet, but their brain is starting to learn where the rest of their body is in space. When you look at infants, a lot of times they'll even slap themselves. They don't have any control at first, but then over time, as they move it more and more and more, they get better and better and better control as they get older and older. It's all because of that proprioceptive stimulation. The brain's able to control everything better. Now, soon, around 6 to 8 to 9 months, the child is actually supposed to start what's called a cross-crawl pattern. This crawling or cross-crawl pattern is very important because that sets up in the brain, it sets a very important foundation in the brain neurologically that you can then build learning on top of, you can build speech on top of, and you can build coordination, walking and running on top of that. I've had patients, infants come into the office that they just skipped the entire crawling phase and they went straight to walking. And these kids, when they would start to run, they'd just trip, they would fall and trip. And several of them, they had delayed speech. They had delayed speech development. And so what we did is we had them start crawling. Immediately when they came into the office, we just have them crawl. And it took about 2 weeks just to go back and reset that solid foundation, get them crawling again, get that solid foundation in their brain, then their speech improved, then everything else improved on top of that. It's really, really fascinating. So we're going to talk about that in a second, what can happen if the joints get locked up and what that is too. When you think about elderly, movement stimulation is essential to the brain function, brain health. Now, a lot of times, especially in the elderly, they get very afraid of falling because they're afraid they might fall and break their hip or something like that. And if you've ever seen someone where they fall, they break their hip, after that they become very fearful of falling. So a lot of times they just sit and they don't do anything. And typically what you'll see with those people that sit and don't do anything, their brain health, everything starts to decline really rapidly. They start to have different organs and systems start to fail. So movement neurology has been described as one of the most essential nutrients for brain health and brain function. Now, I'm going to address what's called a subluxation, because the problem that we have living in an industrialized world, living with traumas, might be a motor vehicle accident, might be a sports injury, might be all these different things in our life. It could be a traumatic birth where there's a lot of pulling and twisting of the child's head. It could be sitting for hours and hours with poor posture. Those things cause trauma, whether they're big macro traumas or small traumas to the body. And then you also got things like eating bad food. If you eat a lot of vegetable oil and omega-6s and a lot of processed foods, then you're going to have a lot of inflammation, chronic inflammation in your body, and that can cause your entire body to have health problems. So there's many different factors that are contributing to this. It could even be mental stress. I'll give you a good example. Think about when you're at the movie theater and you're watching a horror film and you hear that music. You're sitting there, it's silent, but you hear that music and you know the bad guy's about to come out. Think about how you're sitting there, what your body's doing physiologically when you know the bad guy's about to come out. What it is your heart rate's starting to pound. Your heart rate's increasing. Your breathing is shallow, but it's more rapid breathing. Your pupils are dilated, where you're wanting to know what's going on. You're usually gripping onto your chair. Well, my point of that is mental stress could cause all types of muscle tension patterns throughout your body. Now, all of these different things, the physical stresses, the traumas, the inflammation and the traumas from eating bad food, and even the mental stresses that we have, it can cause our body to start to develop scar tissue adhesions in the muscles, in the fascia, which is the covering around the muscle, and in the joints. Okay? So think about this for a second. How many of you have ever rubbed your shoulders? You felt these really big knots, and usually those knots are pretty tender. What those knots are in the shoulders, it could be anywhere in your body. You could have them in your back, you could have them in your arms, you could have them in your elbows, you could have them throughout your body. What those knots are, it's scar tissue adhesions that your body forms in that muscle or in that fascia. And it could have been, maybe you got an accident, maybe you got in a motor vehicle accident, you had whiplash trauma, where you stretched and strained all this, your body will form scar tissue adhesions here. Maybe it's just, again, sitting with poor posture. That's putting strain and stress for 8 hours a day sometimes. Maybe it's just, again, a traumatic birth process or a slip or a fall. Your body will form scar tissue in those joints, in the muscles. So if you think about massaging those, oftentimes when you sit there and you apply pressure to that knot in your muscle, it's like it hurts. But when you apply pressure to it, over time, as you continue to work on that knot will get smaller and smaller and smaller. And then the muscle will feel better and better. So what you're in effect doing by applying pressure, that massaging that area, is you're breaking up those scar tissue adhesions in the muscles so everything can move better and more freely. Okay? Now, one thing to think about and how this falls into chiropractic, that same scar tissue that you feel in the shoulders, or you feel in your back, that same scar tissue gets in, this is a little segment of the spine here, that same scar tissue will then form in all of the muscles. This is looking right at the back. These are called the spinous processes right here. The spinous processes are little points that you feel when you feel down your back. So all of this is surrounded by muscles and ligaments and tendons. That same scar tissue that gets in the muscles here will form in the joints, in the ligaments and the muscles around the spine, and it'll form in the disc. Okay? And what that is, this joint could be in the right alignment, but it's just locked up with all the adhesion around it, or it could be shifted. You You see that shifted out of alignment and locked up in that position. This is what's called, and the research is clear, this is what's called a subluxation. It's right here, S-U-B-L-U-X-A-T-I-O-N, subluxation. That is that loss of motion in the joints, loss of motion in the spine. It can also be loss of motion in your elbow or in your wrist. You can subluxate any joint in your entire body. So when you think of subluxation with all of that adhesions, when you're massaging your shoulders, you can get to the muscles, but you can't get down to that deep tissue. You can't get down to the ligaments. You need, for your joints to be healthy, they have to have movement. They have to have proper motion for your joints to be healthy. So if you have all of these adhesions all in the soft tissue, in the ligaments and the tendons and the disc, that joint is going to be locked up and you're going to lose that motion. Several things happen when that happens. One way to think of a subluxation is think of it as a movement deficiency syndrome. Subluxation is a movement deficiency syndrome. Now, if we tie it back into why is that so important, we'll remember proprioception, that movement stimulation to your brain, is what helps your brain function properly, what helps your brain develop properly and function properly. So if your joints in your spine, think of my two fists here as your joints in your spine, if they're shifted and subluxated and locked up and not moving, this can start to throw your posture off. This can make it where you can't turn and bend as well. This can make it where when you look at someone's posture, this is what feels normal to them because their bones are shifted out of alignment and subluxated. So if you have that subluxation, you are deficient in proprioception. You lose that positive stimulation from your body to your brain. Now it's in segments of your spine. It might be your entire neck, the whole neck. It might be in one bone in your neck. It might be in one bone in your low back and one bone in your upper back. There could be different areas in your spine. Some people, almost their entire spine is subluxated, especially if you had serious traumas, especially if you're sitting with hours and hours of poor posture. But that can subluxate your spine because all that scar tissue adhesions inside the spine locks it up. And so what that means is, if you start to lose that proprioceptive stimulation, remember there's movement affect, so you don't feel as happy or as good as you could feel. Your cognition or your ability to think clearly and to focus, you lose those different functions because you're losing that proprioception. It's just like sitting on your couch all day long, but you're losing that stimulation maybe from whole segments of your spine or individual vertebra of your spine. You lose that proprioceptive stimulation. That stress reduction, you lose that ability from that area of your body to help relax your brain. You lose that ability to relax your brain from that area of your body. That's very important because we have so much stress in our body. And you lose that area of your brain that controls, there's an area of your brain that controls your viscera, all of the organs, like you see in this poster here. You lose that stimulation to that area of your brain that controls your organs. So you might have different organs that start losing the function. There's also another area of your brain, the cerebellum, that controls coordination of all your limbs and coordination of your body. Well, if you are subluxated in your spine and you've lost that proprioceptive, that positive stimulation from your body to your brain, you lose some of that ability to be able to control and coordinate, especially, say it's your neck. If it's subluxated here and you're not sending that good stimulation up to your brain, you're losing control and coordination in your neck. If it's your low back, you're losing control and coordination in your low back. That is detrimental to the overall health of your entire body. Now I'm going to shift over into a couple different things. So subluxations represents a movement deficiency syndrome. For your joints to be healthy, and again, this is well covered in the research in this book. For a joint to be healthy, let's say your elbow, for your joint to be healthy, you need to have motion with it. If you can only bend your elbow just a little bit. We know that there's something wrong with the elbow. We know we need to help do the best we can, try to restore as much of that range of motion as possible. Because if we do not restore that range of motion, your joint is going to degenerate, your joint is going to have arthritis, you're going to have bone spurs, it's going to eventually start to cause problems in that joint, okay? Now, the same thing can be said in your entire spine. If your joints, again, this is two vertebrae here, if your joints are subluxated or locked up where they're not getting good motion, they're not aligned properly, then your individual joints start to degenerate. That segment from your spine, from your body, is not going to send happy, healthy, proprioceptive stimulation to help your brain function better. It's going to send information to your brain about inflammation, because this joint, when you lose that motion, it starts to become inflamed. It starts to become sensitive. It can eventually, over time, even become painful, but you could have it there for years without feeling any pain at all. That's the main reason why I tell people they should get checked where they have pain or they don't have pain. But again, the joint is locked up, it starts to become inflamed. That causes osteoarthritis, degeneration of the joints and inflammation of the joints. What that does, it doesn't send positive stimulation to your brain, it sends a noxious stimulation to your brain, or what's called nociception. Grab this other pen here. So this right here says nociception. Think of noci as a noxious stimulation. So when somebody's being obnoxious, they're being irritating, they're being annoying, you just want to punch them, you know. So that's a noxious stimulation. So if someone's being noxious, it's a negative, not a positive, but a negative stimulation from your body, from that segment in your body to your brain. So let's say this part of your body right here is subluxated, right in your mid-back region. That's the area that's locked up, it's subluxated, it's not getting good movement. First of all, you're deficient in proprioception, so you're not getting that good stimulation to your brain from that area. You're not going to have as good coordination in that area. But also, it becomes inflamed, so that starts to send a nociception, a noxious stimulus to your brain. That could be there for years and you not feel any pain. But there's a couple things that happen. Pain is something that we are consciously aware of. Like we know, like your brain knows, if you're in pain in your low back, that means that area of your low back is sending so much of this nociceptive stimulation to your brain that your brain is saying, wow, my back hurts. But here's the thing, this right here, nociception can be going on in your body, inflammation in your joints can be going on in your body without you being consciously aware of that. So you might not have any pain or any symptoms at all. Now here's what I want you to know what happens when this nociception reaches your brain. Again, it's the exact opposite of what proprioception does. So there's an area of your brain called the amygdala. That is the stress and anxiety center in your brain. So what's happening is when you have proprioception, it's going up to the, let's say it's right here in your brain here. It's going up, it's stimulating that area over, and over, it's stimulating your amygdala. What that does is the amygdala releases stress hormones. We all have heard of epinephrine, norepinephrine, so your adrenaline, cortisol, all of those different hormones, those stress hormones. The release of stress hormones in your brain will then send signals down to your adrenal glands. Your adrenal glands are glands right on top of your kidneys. These are your stress glands. So it sends information back down to your adrenal glands, and that causes more of the release of stress hormones in your entire body, in your whole ecosystem. So what stress hormones do is they set you up for fight or flight. Stress hormones are released to set you up so your body can respond to a stressor in its environment. So here's things that happen. Let me give you an example. Let's say Let's say you're a hunter-gatherer, okay? And so you're down by the water hole and you're getting some water, getting some water to drink. No problem. Then all of a sudden, a bear jumps out of the woods, jumps out of the bush right behind you. First of all, what's going to happen is your body, you're going to release all of these stress hormones in your brain. You're going to release these stress hormones in your body to get your body in a state that you can survive that stressful situation. So you're going to get into fight or flight. So what that means is your body's going to get so it can either fight the bear or you're going to be able to find an escape route and run from it. So it's very healthy and very important for us to have that response in response to any big stressors like that. So here's things that will happen if a bear comes. First of all, let's say you're afraid of bears, okay? Say we're all afraid of bears, especially if it's a hungry bear and it's right there beside you. So your heart rate's going to go up. And that's a very smart and intelligent thing in that situation. Your blood pressure is going to go up. You want all the blood going to all of your organs, like your stomach, your liver, your kidneys, your intestines. All of that is going to be closed off and shut off because you're not worried about digesting your steak. You're not worried about digesting your breakfast or your lunch or your salad, whatever it is you had. That's not going to save you from that bear attack. So all of the organ function is going to be shut down. All that blood that was going to your organs is going to go to your muscles and to your brain. That is very important because your brain and muscles is what's going to help you either fight or escape that stressful situation. So very important to do. Your blood sugar, the blood sugar when a bear comes is going to skyrocket. And you want that to go up because you want your muscles and your brain use glucose as energy. So with the glucose, you want to be able to fight the bear or run from it. So it's a very intelligent response. Your LDL cholesterol, this is considered the bad cholesterol. First of all, there's not a bad cholesterol in your body. It's appropriate for the environment that you have yourself in. It's appropriate cholesterol for the environment that you have yourself in. There's no thing as bad cholesterol. So here's the thing. When you are in that situation where the bear is attacking, you want your LDL cholesterol to go up. You also want other sticky factors in your blood to go up because LDL cholesterol and other sticky factors in your blood help to clot wounds. So if you think about it, when you're there with the bear, what are the chances that the bear is going to scratch you, right? Or cut you or bite you? You want your cholesterol, LDL cholesterol to go high and your other sticky factors to go up to help to clot that wound. It's very important for survival. So again, it's very, very smart. When you look at your immune system, in that situation, your immune system is going to be run down. Your immune system is not going to be as strong. Think about the last time you had the cold or flu. Did you have tons of energy or were you completely exhausted? I think it's pretty obvious. Everyone gets completely exhausted when they have the cold or flu because when you have the cold or flu, your immune system is kicking into overdrive. The white blood cells are working to fight off the bacteria and fight off the viruses or the pathogen, whatever it is. They're working to fight those things off. Your immune system is very metabolically expensive, meaning it requires a lot of your energy to run. So when you're back in that situation where a bear is there next to you, you don't want to be using all of your energy to go to your immune system, your white blood cells, because there's not a white blood cell that's going to be able to fight off the bear. So for survival, what you want is to shut that system down because it requires too much energy and use all of that energy to go to your muscles and to your brain to fight the bear. Again, very smart, very, very smart in that situation. Your ability to remember your grocery list, your ability to learn calculus, learning new things, that gets greatly inhibited or hampered because you're not going to be able to do that when the bear's right there on top of you. Your sex drive or sex function, you're not thinking about hanky-panky when a bear's here. It's just not important for survival. Now, when you fight that bear or run from it and you're surviving, then you want your immune system to come back into play. You're running, you're getting that proprioception, which is also calming down the stress and anxiety centers. It's also calming down the stress, the amygdala. It's calming down all those things. That movement is essential for us to get it back into a place of homeostasis, back into a place of balance. But now think about this for a second. Imagine you had that bear in your life every single day of your life. It could be that bear, that bear could be, worrying about bills, worrying about appointment you have, or dreading or being negatively affected by past memories or past appointments or past experiences in your life. Getting in a fight with your spouse, getting angry when you're driving down the road. That's a choice. You can choose to just lay back and be relaxed, or you can get hyped up and get ticked off when someone cuts you off. So that that could be a bear in your life. If you're eating bad food every single day, if you're eating processed food every day, that's a bear in your life. If you have areas in your spine that are the joints in your body, especially in your spine, because that's the area that has the most nerves, if the joints are subluxated and locked up, and that's sending a nociceptive, noxious stimulus to your amygdala and to your brain, that's a bear in your life. That's a bear in your life. So what's happening every time you're getting that nociceptive stimulation, blood pressure can go up, your LDL cholesterol can go up. The same thing with all these other bears that we're talking about. Your immune system can weaken, your sex drive can wane or decrease. All of these different things can happen because you have all these different bears in your life. So one of the keys to keeping your body healthy and functioning at a higher state is to be able to identify what those bears are. Because again, this chiropractic is a piece to the whole puzzle, because you might need to work on the different stresses that you have in your life. You might need to work on having times of gratitude and love and joy instead of just fear, anxiety, worry, and resentment. You might need to start working on your diet, have a more pure and sufficient diet instead of a very toxic. Nociception is toxic to your brain. So instead of having a toxic diet, you might need to work on your diet. And you might need to work on more movement to get this positive stimulation to calm all these things down. Now, back to chiropractic. If your joints are inflamed, if they're subluxating, they're inflamed and degenerating, you're stimulating this negative nociceptive pathway from your body to your brain that sets you up for fight or flight. You can't focus as well, you can't concentrate, you're not as happy. Have you ever noticed people that have chronic pain? In most situations, they're a little more edgy. In some situations, there's a lot more edgy. In some situations, they can't tolerate their kids screaming and making a lot of noise. They just can't do it because that takes them over the top. It's just too much because they already have all this stuff going in their body and their brain. So by being able to decrease this nociception and increase the proprioception, you can help restore your brain and your body back to balance and homeostasis, which is where we want to be at for health and well-being, for growth and repair. So what the adjustment does, every time I have a patient come in, I feel for those areas in their spine that are locked up, that are subluxated, and that are not moving. We check people's range of motion. See what areas, if they have areas that are restricted, going to one side or the other, that are subluxated and locked up and not moving. Oftentimes we'll look at x-rays for areas that we find the arthritis, because there's inflammation, degeneration. Arthritis, arth stands for joints. Itis is inflammation. So arthritis is inflammation of your joints. And so if we see on x-rays, that shows up on x-rays. If you see that on x-rays, then we know for a fact that you have nociceptive input coming from that area of your body to your brain, causing all those things to happen inside your body. And it's negatively affecting the health of your body. So we identify those areas. And when we do an adjustment, sometimes it might be with a neck adjustment, we do a manual adjustment, or we might push down on someone's back to restore the motion. Remember how we go back? Remember all that scar tissue adhesions that forms in the muscles? That same stuff forms in all of the joints around the disc, around the joints in the back, and around the muscles. The chiropractic adjustment breaks up those scar tissue adhesions. And when you break up that scar tissue adhesions, you correct that movement deficiency syndrome. You restore motion back to that area of the spine. You restore that movement neurology, that proprioception. You restore that positive stimulation from your body to your brain, and you also decrease, because when you get motion, you decrease the inflammation. Movement is one of the best anti-inflammatories for your entire body, especially for your joints. Movement decreases inflammation in your joints. So when you get adjusted, you decrease this negative input from that area of your brain, decrease inflammation in your joints, can help slow down the degeneration process, and you help to restore that positive stimulus, that proprioception. You help to restore that essential nutrient, the most essential nutrient that literally grows brain cells in areas like your hippocampus, that calms down the amygdala, your stress and anxiety center, that helps your cerebellum control and coordinate the whole function and movement of your entire body. It helps areas in your brain that control your viscera, which are in your brainstem. It helps areas in your both of your hemispheres up top help you think clearly and be able to focus and pay attention and be able to do problem solving. That proprioception is essential for the whole body. So, a lot of times people ask me, once they understand how this can go on without pain, there's actually research to show that those scar tissue adhesions that we talked about that can form in the muscles and inside the joints, if we do not take our spine, all of our joints through a full range of motion, doing stretching, these are things that we help guide our patients on. But if we do not take our spine through a full range of motion, and with all the stresses, the physical, the chemical, and the emotional stresses, in as little as 3 to 6 days, your body will start to form scar tissue adhesions in all of the joints in your spine that you're not moving. 3 to 6 days, your body can form scar tissue adhesions. What that means is, again, if you're forming those scar tissue adhesions, you're forming the subluxations in your spine, you're now deficient in that movement, deficient in the proprioceptive stimulation, so your brain, your body's out of balance, you're not at homeostasis. And when you have the subluxations, you have more nociception because you have that inflammation, which that fires off the amygdala, sets you up for fight or flight response. And again, it sets you up to try to adapt to stressors in your life. And so it puts you into fight or flight, which is not, that fight or flight is not about health, growth, and repair. Fight or flight is about survival of that situation. That's what fight or flight's about. So people ask me, how long should I get adjusted for? Once you understand that information, once you understand that your joints can get locked up in 3 to 6 days. Now that can vary. I have some patients that eat nothing but organic food, really healthy, whole food based diet. I have patients that those same patients practice yoga and exercise, and they're doing some weight resistance training, but they're also doing walking and hiking and yoga, and they're in their garden working, exercising. Very low stress. They're not sitting for hours and hours to have that physical stress. They haven't had a lot of traumas to their body, but mentally they have very low stress in their life. For those patients, I have those patients, a lot of those patients come in once a month. They get adjusted once a month just to make sure, because again, in 3 to 6 days, if you have all these stressors in your life, in 3 to 6 days your joints can get locked up. But for the patients that have a really healthy lifestyle, they don't need to come in as often. So some patients come in once a month just to make sure that we can identify those areas where the scar tissue is starting to form, the joints are becoming locked up and sticky, they're causing inflammation, they're losing that proprioception from that area. And so we'll adjust them once a month just to keep everything fine-tuned and maintained. Now, I have some patients that they don't have the best diet, they don't exercise all the time, and they have high stress. Some of those patients who have been with us for years are still getting adjusted once a week. Some of them get adjusted once every 2 weeks. But again, if you're not taking your body through a full range of motion in 3 to 6 days, your body will start to form scar tissue adhesions that will lock up your joints, that will cause this whole process that we just talked about. So it all depends on the person's lifestyle, how often I would recommend they get adjusted. But then another question that comes up is how long should I continue to get adjusted? And a great question to you about that is, how long will you continue to sit for hours and hours of poor posture? Many of you have had traumas to your spine that haven't fully healed properly. How long will you continue to eat bad food or have toxins in the environment, stressors in the environment, mental stressors? All of those things can happen. For most people, I think we'd all agree that those things are going to continue to happen for our entire life. And so that's why we work with people from 1 day old. That's the youngest we ever adjusted a patient was 1 day old. The oldest patient I've ever worked with was 96 years old. It's good through all stages of life because proprioception is always good for brain function, doesn't matter what age you are. And that proper brain function helps control and coordinate the function of your entire body. So how long? Well, here's another question. How long should you continue to brush your teeth? How long should you continue to exercise? How long should you focus on prayer and meditation, whatever it is that helps you mentally relax and calm down? I think the answer to those, and I hope that you would agree, maybe you'll agree with this or maybe not. I believe the answer to those questions is I want to do those things as long as I want to be healthy. So just like all of those things, this is part of a lifestyle to help you keep your spine, keep your body healthy. This is very deep. This is meaty. I've got the research here. If you actually want the references, I can get those references for you. A lot of them from the Journal of Manipulative Physiotherapeutics. There's several of them from neuroscience journals. Because chiropractic is definitely about restoring that movement back in your body, restoring that posture back in your body, keeping your body and your brain functioning better in a better state. So this is a long one, but for those few people that are going to watch this, hope you enjoyed it. If you have any questions, let me know. I love talking about this stuff. We'll see you in another video.